This briefing was organized in response to Congressional Office's interest in this topic, and specifically, we partnered with the Congressional Victims' Rights Caucus to coordinate this event. I want to mention our other key collaborators before we move into the content of the program. They include Pennsylvania State University's Center for Healthy Children and the Global Alliance for Behavioral Health and Social Justice. Our primary sponsors for this afternoon's briefing are the Society for the Psychological Study of Social Issues and the National Prevention Science Coalition. I want to quickly mention that we're going to have an evaluation forum. All of the folks that were involved in putting this together are very much interested in your feedback as we move forward on these issues after today. So I encourage you to pick one of those up and fill it out at the end of our briefing or when you leave. So, as Representative Poe mentioned, addressing the problem of human trafficking is challenging. It's not impossible, but it's challenging because it encompasses a range of circumstances, it often overlaps with related crimes, and it can be difficult to measure. We have to consider how factors at the individual, interpersonal, institutional, community, and societal levels all contribute to human trafficking, and all could potentially be targeted for intervention. So there is a need for a multi-tiered strategy that better assesses risk and protection, provides an array of services to meet the unique needs of victims and survivors, and reduces the vulnerability of children and youth to trafficking. While we have made progress, researchers and others have noted that the current responses that we have often address the symptoms and not the underlying structural and systemic causes of human trafficking. Many of the programs in the US, which are incredibly important, focused on the response, as the representative was saying, to victims and survivors of human trafficking. By contrast, preventive approaches, when they are present, can in part focus on strengthening vulnerable and at-risk children, increasing their resilience to becoming victims. As noted by the U.S. Department of State and others, the fundamental framework used by the U.S. and others includes what's called the 4 Ps: prevention, protection, prosecution and partnership, and program evaluation. Today, in this briefing, we're going to focus on the lessons learned from the growing research base on the first of those 4 Ps, prevention. We know that the limited evidence base could and should be strengthened through rigorous evaluation of promising prevention and intervention practices that we're going to be discussing today. So it's my pleasure now to turn and to introduce Dr. Hani Stoklosa. She's the Executive Director of HEAL Trafficking, an emergency physician at Brigham and Women's Hospital with appointments at Harvard Medical School, Harvard T.H. Chan School of Public Health, and the Harvard Humanitarian Initiative. Dr. Stoklosa is an internationally recognized expert, advocate, researcher, and speaker on the well-being of trafficking survivors in the U.S. and internationally through a public health lens. Dr. Stoklosa?
Thank you. Good afternoon, everyone. We could keep the slide on the sloth. He's awfully cute there. But thank you for the opportunity to speak with you all today. I am an emergency medicine physician practicing at Brigham and Women's Hospital and executive director of HEAL Trafficking, which is a network of now over 1,200 professionals that are fighting trafficking through a public health lens. So prevention really is what we are about as a network with that public health framework. HEAL Trafficking believes that we cannot arrest or prosecute our way out of trafficking, but we need to think upstream and proactively prevent trafficking from occurring in the first place. I applaud Representative Poe and the Victims' Rights Caucus for hosting this briefing today and look forward to seeing how this briefing translates into future action. And I really like some of your suggestions for federal implementation. Earlier, Dr. Reed talked about the various levels at which a public health approach looks at risk and resilience factors for trafficking. Through the course of these presentations, we've been walking you through each of these levels, and now we find ourselves here at the individual level. So we've gone from societal all the way down here. We believe that the individual level for risk of trafficking includes immigration status, history of abuse, homelessness or runaway status, LGBTQ, being systems involved in individual stigma and discrimination. The list could go on and on. But the truth is that we need research at each level of this model to truly understand the victim and the perpetrator, as was pointed out, and risk and resilience factors. And as Dr. Reed pointed out, we've identified some of these particularly vulnerable populations, but by focusing just on those ones, there may be other populations that we're ignoring, so we need to know more. We need more research. Earlier this year, HEAL published a research agenda on trafficking in the American Journal of Public Health that calls for this body of prevention research. And I have a copy of it out there if you want to peruse it. So as Dr. McLeay mentioned, as public health professionals, we think about prevention in these different levels. So when we're talking about primary prevention, this is what we're talking about in terms of preventing something from happening in the first place. And this has really largely been absent from the discussion around prevention and trafficking. The other forms of prevention that we think about from a public health, as public health professionals are secondary prevention and tertiary prevention. So secondary prevention is preventing something, for example, in the case of trafficking, stopping trafficking early before harm comes to the victim. And then finally, tertiary prevention, and I have the picture here of a revolving door, is like basically putting a wedge under that revolving door. So tertiary prevention is stopping that cycle of re-victimization. So after somebody is out of trafficking, preventing them from being re-trafficked. Those are all forms of trafficking, but the one that tends to be all forms of prevention. The form of prevention that tends to be ignored is primary prevention. Trafficking is not a siloed phenomenon, and this has been said over and over again. So as we look upstream from trafficking, we find many risk factors in common with other forms of interpersonal violence. And therefore, we can learn so much from the fields of child maltreatment as well as interpersonal violence as we design systems of response for trafficking. So we have those foundations to build upon. Prevention of complex social problems requires complex solutions. We have learned this from fields such as gender-based violence and intimate partner violence. Using singular tactics is insufficient, and we need to come at it from multi-level, multi-pronged approaches. A particularly vulnerable population of individuals to trafficking are school-aged children. As a result, a number of programs around the country have undertaken trafficking prevention curriculums for this population. Audrey will be speaking in a little bit about the impact of My Life, My Choice. And I'm going to highlight one of a different one of the US-based school curriculums that are out there. There is currently a program being undertaken by 3 US-based nonprofit organizations to understand how prevention education can affect the vulnerability of children to human trafficking. 3 Strands, Global, Love Never Fails, and Frederick Douglass Family Initiatives launched Protect, Prevention Organized to Educate Children on Trafficking, in 2016. Protect starts by supporting agreed-upon local response protocols and then trains educators to implement classroom curricula for 5th, 7th, 9th, and 11th graders. These are grade-level appropriate state standard compliant lessons and provide a holistic view of trafficking. Protect is being implemented now in California rural counties as well as select urban counties and 1 Utah school district. The collaboration believes this is the largest and most comprehensive human trafficking prevention education effort undertaken in the United States. So I'm excited to see the impact of this curriculum. Much of the focus of this briefing has been on prevention of sex trafficking, but what works on the labor trafficking side of things? We've learned from our colleagues that awareness campaigns in of themselves are ineffective and sometimes lead to increased stigma and sometimes lead to increased harm. We need to recognize individuals as the rational actors as they are, and that quote that you shared was so powerful about not having any alternatives. We see this with labor trafficking as well, realizing that as we're designing awareness campaigns in tandem with other programs, that we need to really approach it as realizing those individuals are acting and taking risks as rational actors. We've learned that interventions that help decrease labor exploitation in general lead to decreased trafficking. So this is what the literature review of some of the international labor trafficking research has shown. So by improving labor organizing, workplace safety, and whistleblower mechanisms, you create an environment that decreases labor exploitation and in turn decreases labor trafficking. We've also learned that prevention efforts must be sector specific. So what works to decrease forced drug muling among gang members may be different from magazine sales crews. So we need to have individualized, tailored prevention strategies. And finally, to close, I'm going to put on my clinical emergency medicine physician hat here. So as you've probably seen in the media, the opioid epidemic is everywhere, and certainly as an emergency medicine doctor, I've never seen so many deaths from opioid overdose. But what most people don't realize is that traffickers are actively using opioids as the tether and as the trap to ensnare their victims across the United States. In Boston, they'll recruit trafficking victims right outside of methadone clinics. I'm going to tell you a story of one of my patients. Caitlin got hooked on oxycodone after she had her wisdom teeth removed. And then after she had this addiction, she was looking for cheaper alternatives and turned to heroin. It's much, much cheaper. And then she found herself in this position where in order to pay for her drugs, she would sell her body. And throughout this time, she was going in and out of healthcare facilities, in and out of emergency departments. One day at a drug treatment program, she met a woman who connected her to a guy who promised a ready supply of heroin. And that was the beginning of her nightmare of human trafficking. She was transported across state lines to a hotel room where she was locked in, drugged, and forced to have sex with multiple clients day after day, night after night. Caitlin has changed how I see my role as an emergency medicine physician and think about how I could have intervened if I had seen her in one of those prior emergency medicine visits. Could her trafficking have been prevented? What if somebody had intervened earlier? So now I see, not only am I screening for trafficking victims in my emergency department, but now I see these opportunities with patients like Caitlin as an opportunity for prevention intervention. But we need more research to test this out. My current practice is engaging in motivational interviewing, which is an empowering technique to educate somebody about trafficking, their risk for it, and thinking about their safety planning, including giving them the National Human Trafficking Hotline number. Imagine for a moment a world where there is no trafficking, where we are all free from exploitation. We need critical resources to further understand what is driving trafficking and to invest in prevention and interventions to know what works and what doesn't work and what causes harm and what is effective. Trafficking prevention is the greatest of opportunities and responsibilities. Thank you.